Welcome back. Glad you're with us. You know, flu is now making its way through our community, and while the numbers are still low from what we understand across the state, doctors say now is the time to protect yourself from this seasonal illness. So joining us now with more from Children's Hospital is ER Director Dr. Ryan Redmond. It's good to see you.
Well, thank you.
You seeing the flu at Children's?
We are, and it comes as kind of a surprise or a shock because last year, of course, we didn't have any, what essentially amounted to no flu. So seeing it kind of pop up again this year has been concerning.
How many cases are you seeing right now?
Well, we're definitely seeing a solid trend upwards, where in the past week or so we've seen double what we had seen before. So we're in the 50s or 60s so far.
Oh my goodness. Do you think it has anything to do with more mask wearing maybe last year as opposed to this?
Yeah, absolutely. We know that as a respiratory virus, in the same way that masks prevent COVID and protect against COVID, they do the same for flu. So, you know, now that we're doing less of that and people are around each other more, it was kind of inevitable that we knew that this was going to come back. We just, as with flu, most years we don't know exactly when that's going to happen.
Right, and they're popping up. So what are the signs and symptoms parents need to look for?
So the biggest thing is going to be fever, body aches, respiratory symptoms, and sometimes vomiting, diarrhea type stuff.
We always worry about those who are at higher risk for complications. They're not as common, thankfully, but who is at risk here?
It's the same as kind of with COVID. It's the extremes of age, so above 65 or the younger you are, or if you have other underlying health conditions, of course. Those put you at bigger risk, make it much more important that you get protected.
How can we prevent it? I know the answer.
Vaccination is the best way to prevent it. Again, there are therapeutics that can help if you do get it, but the best way to avoid complications is with prevention. So vaccination is the key. Because we're starting to see it already, it's really important to get that done early because remember, it takes about 2 weeks for that to take effect.
Right, and you always say it's really not too late. I mean, you just go ahead and get it.
Just go ahead and get it. And then also, I mean, one of the other good things about this is that for the past couple of years now, we've learned all of those other pillars of prevention for any infectious disease, of good hand washing, separating when you're sick, all of that kind of stuff. All of that's applied to COVID certainly applies to flu.
Sure. And real quick before we let you go, what are some things parents can do to just help their kids feel better at home? And when do they need to come see you?
So the biggest thing is going to be rest, fluids, and then Tylenol, ibuprofen for fevers. You know, that's going to make you feel better. They need to come see us if there's problems with dehydration or breathing. Those are the big things you can run into trouble with any viral infection, but especially the flu. If you're running into those things, call your doctor or come see us.
Thank you so much. We appreciate it.
Certainly.
All right. And if you have a question about your child's health you'd like for us to get answered, just send me an email at ltucker@wate.com and then tune in right here every Thursday at 4 to see if we answer your question on the air.